Hello everyone, welcome to my YouTube channel. My name is Chris and this is Crisp Digitals. If you're joining me for the first time, I want to welcome you especially, and if you are a returning subscriber, I want to thank you for supporting the channel and thank you again for coming back. If you haven't subscribed, please go ahead and subscribe to this channel. All right, let's jump into this. I know it's been a while that I recorded a video on my YouTube channel. I've been busy, life happens, but I'm here now, so let's get into this video. So today I will be talking about a nursing student study planner. I'm using OneNote for this. I've designed this specifically for nursing students. So if you're into the nursing program and you're looking for something that you want to use to take notes and plan your curriculum or plan your clinicals, this will be a good notebook for you. All right, what you require to use this is a OneNote app, or OneNote Windows app, I should say. Okay, and let's jump into it. Okay, so the first thing you guys gonna see is the home screen. All right, so the home screen, we have the thank you page for those who are supporting me, and if you bought this, so you're going to see this thank you page or section around this page, and in front here you will see the nursing home screen. Here it clearly says this digital planner is structured for nursing students with features to help with organizing their academics, clinicals, and personal schedule efficiently. All right, and right here you're going to put the name of your school, so you can edit this and just put the name of your school. Like I can just put something here, right? Okay, and over here is the notebook navigation tools. So right here you have the navigation tools. Okay, and I put a little note here for you guys, so you guys know that each of these 7 sections have their individual pages with full features, all right, of everything needed for organizing your studies efficiently. So to navigate a section, click on the icon of the section you would like to visit. Okay, so for example, let's go to the course planning. So if I go here, so let me just point this out. You can use this navigation area here, or you can just go top here and just navigate. Right, the top here are your sections. All right, okay, so let's do that. So right here I have my section and there's my page. All right, so over here, as you guys can see, you have the home button here. So if I click on this, it takes me back to the home, and I'm going to click this back to go into the syllabus overview, which is the course planning. All right, and over here you have the icons that will lead you to different sections and pages of this notebook. All right, as a nursing student, you will have a syllabus, so you want to put down the course name that you have. So right here I just say course name here, so you're going to take this out. All right, and you're going to put on the course name. All right, so that's just an example. I don't want this video to be long, so I'm not going to be talking too much. All right, so here you're going to put the professor's name, all right, and the professor's contact information, phone number, office number, email address. You're going to put it there. So you're going to add all the course you've taken and the professor's names and their contact number. If you have more than one more than this space needed for your professors, you can just click on this and you can just control enter, and another one has been created. I can control enter again, another one has been created. Okay, so you can do that. Okay, all right, so you can do that. The next thing is the course objectives. So right here you're going to write down the objective of the course, right, and you're going to list them, right here. And for your textbooks that you'll be using, you're going to list the required textbooks that you need for this for your entire nursing program. Okay, you're going to list them here, and important dates. So your important dates are your exams, project deadlines, quizzes, and tests. So you're going to put those important dates. Usually the first day of school, the instructors or the program directors or your professors would tell you the dates you'll be having your exams, your tests, your quizzes. They will put them here. Sometimes they might have a pop quiz or something like that, but you know, that's something you have to prepare for anyway as a college student. Always be ready. But most of the time they will tell you when your exams are going to be. Okay, so you guys can also keep an eye on that. All right, so over here I have the weekly plans. So if I click on this, you see your weekly plans right here. So these are your weekly lecture plans. When I created this, it was week 35, and that was in August. Okay, so that's a long time. So we are right now September 16. So right now this will not be the week, right? So you're just going to correspond that week, okay, to where you are. So I'm thinking we might be somewhere 39 maybe, or yeah, maybe 39 or 40. So that's probably where you are. Whenever you're watching this or whenever you download this, you'll be able to figure out what week you are on. When you check on your calendar, okay, on your Google Calendar, it will tell you actually what week you are on. Then you can use that to plan your topics and your lectures, your reading material, your assignments, and your quizzes / your exams. Okay. And down here you have your study resources. So here you're going to have like a bullet list of your study resources, your online videos that you need to watch. Like some schools, some lecturers will give you videos to watch. Okay, I remember when I was in school too, they gave us some video to go watch and take some notes about the videos and react to the videos and then present something about it. Or sometimes you see part of the videos that you just watched, you see that on your exam. Okay, so you can put the video title here and the link. If it's like an online video like a YouTube, you can just put the link there. And for your textbooks, you want to put the textbooks here and the chapters, all right, that you read. And for your articles, you can put the link of the article here, and you can put the title of the articles and their links. Okay, and the next one is your lecture note. So your lecture note, this is a place where the magic happens, right? So right here, you're going to put a date, the month, the day, and the year of that lecture. The lecture title, you're going to insert that here. You're going to remove this, right? And you're going to type in whatever that lecture is. All right. Okay, let's undo this. All right, so the objectives of the lecture, you're going to put it here. It's a bullet point. You're going to type them here. And the key points, all right, you're going to bullet them here, and you're going to, write the key points of your lecture. And then questions, right? You're going to list the questions that you have for clarification, all right? And over here you have the chapter that you're dealing with, and you have the instructor's name right here. And over here, I forgot to tell you guys, is where you put the name of the lecture. Okay, whatever you have in the topic of that lecture, you're going to put it here. And over here is your note area. So this entire place is your infinite canvas, okay, where you can type and write. Okay, so like I put a reminder here, it says, remember that this is an infinite canvas and you can take unlimited notes on this page without running out of writing area. Okay, so here you can just start writing. Okay, this is this entire space all the way to the right side of it, to the bottom of it. You can just keep writing. So the other thing you can do is screen clipping. So for example, if you're having a lecture about the anatomy of the heart and you want to bring an image from Google or from Safari and you want to copy and paste them onto this, you can just use the screen snipping tool of OneNote by going to Insert, Screen Clipping. You click on that, and whatever you've opened before, You can just either copy the entire thing, or you can just copy just this area with the image. So let me say I just copy this entire area, okay, and it will bring it into my notes area, so I can now move it to where I want it. All right, so let's say I want to move it here, okay, and I can come here and just reduce the size as well if I want to, right? And I can leave it like that, or I can also come down here, right click on the image, and then go to set as picture background. So now I cannot move it anymore. It is not part of the canvas. So I can annotate inside of this. I can go up here where it says draw, and I can take any of this pencil image, pencil color. Let's say we're using the red one. Click on that, and I can come here and I can just annotate, right? I can just do stuff here. All right, I can just draw into it, like point to it, and I can say, I can write something about the pulmonary vein, okay? I can write something about the mitral bicuspid valve, okay? I can just do anything within this, okay? And it's part of this entire stuff. All right, so that's what you can do with this lecture area, and you can still have, let me take this out, and you can still have this entire area to also write. Okay, you can color this, you can increase it, you can increase the font, you can color this, or you can actually highlight this. Let's just highlight that. So right there is highlighted, and you can keep writing. Okay, so you can do a lot with this lecture space. Okay, the next thing we're going to do is we're going to go to the clinical rotation area. Okay, and by the way, after you're done with this lecture, and say the next day you come to school and it's a different topic, or it's a continuation of the topic. If it's a continuation of the topic, you just continue here. Just create like either a new, like just put continuation down here, right? Or you can just create a new, highlight that, okay? Or you can just create a new notes for this side, a new page for this. And for you to do that, you don't need to create this entire thing by itself, like to make it look similar. You don't have to do that. I've done that work for you. All you have to do is go to where it says add page, and you click on it, and now you have a brand new page. Okay, you can now start taking your notes again. And once you're done with that, the next day you need another one, you click on it. So the more you click, let me just show you, you can see how many notes I've created on the side. See that? They are all similar, they are all the same. Okay, so that's how you can do that. All right, let me just take all of this out. All right, so we are left with the one that we started with. Okay, all right, so the next thing we want to do, we're going to go to the clinical rotation. All right, so click on that, and over here we have this section where you have your clinical rotation schedule. All right, so this is where you plan your clinical rotation. All right, so to do that, you find where you have the month of your clinical rotation. We're no longer in August. Right now we're in September. For example, if you are doing your clinical rotation in September of 2024, this is where you will go, and you click on that, and now you have this calendar, right, where you can schedule your clinical rotation. Okay, you can type inside the boxes, all right, and you can type the days you go into clinical rotations. You can type them. So for example, the 18, you have to go to a clinical rotation. You can just type in 7 a.m. you have to be there. and that's you leave at 1 p.m. Okay, so you can write that there. I don't like that. Okay, let's bring it down. All right, so you can highlight that as well. Okay, so that's 7 a.m. to 1 p.m. on the 18th. Now, you want to also make sure it reminds you, because on itself, this is a planner. All right, though it's digital planner, it doesn't have any integration to your native phones or computers calendar. All right, but what I've done, I've made it so that you can be able to save this as well in your calendar. So if you go to where it says September 2024, where the icon is, if you click on it, it will take you to your Google Calendar. All right, so on the Google Calendar, you can go to the 18th and you can enter that clinical rotation. Okay, so you can put clinical rotation, and you can put the time. Okay, let's say it's we say 7 a.m. All right, 7 a.m. and we can put it to 1 p.m. All right, and then we can save on it. So we just save that. So it's going to remind us, okay, on that day. All right, or maybe you can set it for 1 day to remind you, or 1 hour to remind you. Okay, so you can do that. So now when that time comes and your calendar reminds you, you know you have that clinical rotation. And that's how it is for the next one. So if I want to go to October, I can click next. November, I can click next. And December, I can click next. Okay, I can go back to this screen by just clicking that. And now you can also navigate to 2025, because most school, they start from August of the current year to June, July of the next year. Usually that's the school year, right? So you can also go to 2025 right here. Okay, that's January 2025, and you can also click there to go to your Google. So they are all linked for you. Okay, let's go back. All right, so the next thing you're gonna do, let's go to the weekly schedule. So everything here, this is your clinical schedule. Let me lower that. So your weekly schedule is this area. So this is a place you're going to put the week off. So you're going to take this out. I'm going to put the week off. So I'll say, example, the week of the 40. Okay, so that's the week of 40. So you're going to write whatever I got to write there. Let me undo that. And here you're going to put the day of the week. So it's like Monday, right? The site name for your clinical rotation. So the site name will be, say, example, Methodist Hospital. I say Methodist Hospital because that's the one I remember the most when I was a student. So that's one of my clinical sites as a surgical tech then, right? So here I'll put Methodist Hospital, and then the shift time I'll put morning shift, and the task and notes I'll write them here. Okay, and then I have a big area where I can do a lot of notes, like clinical notes, things I learned for that week. For that day, actually, I'm going to write it down there, or for the week, for the entire week, I'm going to write it down here, because this is a weekly schedule. So it will make sense that this notes area will be everything you've learned, everything you've observed, and every criticism you've got that are constructive. You're going to write everything here. Okay, so you're going to do the same for Tuesday, Wednesday, Thursday, and Friday. Okay, and over here I put to create a new weekly schedule, click on Add Page. All right, on the left upper panel, a template has been set up to duplicate this page. Yes, so if I want a new week, so I want to go to week 41, I can just click on Add Page, and then a new week will appear, and then I can change this to week 41. Okay, so that's how you can do that. Let me take this out. All right, next we're going to go to the day log, or the daily log. So this is the day of your clinical rotation, right? So right here, you're going to go to the date. You're going to type in the date right here. You're going to type in the interaction with your patient. You're going to put the procedure that was done. If you're doing like clinical rotation inside the OR, so you're going to put it right here. But if it's like doing rounds or in the ICU or something like that, you're going to write whatever you need to write here. That be for the procedure that you observed or that was done. Either a central line was placed or something else was done up there in the unit. You're going to write the procedure there. And any medication that was administered or given by you or by your preceptor, you're going to put them here. And this is a space to put down your reflection for that day, right? And here is a case study. All right, so patient history, you're going to put it here. Diagnosis, you're going to put it there. Treatment plan, you're going to put it there. Reflection, you're going to put it there. So over here is the skills checklist. So you want to put in the skills that you have, right? Or you are practicing, actually the skill that you're practicing, or you are looking to gain that particular day. Maybe how to put on an IV, or put in an IV on a patient, or how to draw blood or administer IV line or something like that. So that skill, you want to put it here. And you also want to put a date that you practice that particular skill and the date you actually mastered it, and then the sign off from your supervisor. And over here will be your reflections. You're going to just give some highlight summary of your clinical day. So at the end of the day, you get home, you want to just reflect on how you did for that day. And here I put some pointers for you, what went well, so you're going to type them there. The challenges you faced, you're going to put them there. The learning points, you got to put it there as well. And if you want to duplicate this page, you're not going to just click add page, because if you click add page, it's going to duplicate the weekly page. Instead, what you're going to do is this. You're going to go to insert, okay, and you're going to go to page template. All right, and you're going to go to page template down here. All right, mine is already showing me here, but for you, if you're doing this for the first time, you're going to go here because yours might not be showing you there, okay? Because I've used mine a lot. So I'll come here, click on that. So all the way here to your right hand corner, you're going to go to this arrow down here, and then you're going to go to this place where it says my template. So you're going to go to where it says my templates, and you're going to bring this down, and you're going to look for daily log. All right, so just yours should appear. All right, so you're going to look for daily log, and right here, that's where mine is. So I'm going to click on it, and it will give me the duplicate of the daily log. See that? Okay. All right, so that's how you'll be able to duplicate that daily log. Okay. All right, I'm going to take this out. Okay, so the next one is we're going to go to assignments and projects. So click on that. So this will be your assignment tracking area. So over here you have your assignment name. So you're going to type the name, title of the assignment, the course name, the status, okay? All right, and the additional notes you want to put here. So once you've started doing the assignment or the project, and you and your team, you guys have started doing the assignment or the project, you can come here and just drag it over here. So it says started. So this is a Kanban board sort of way that I created for this. And if it's in progress, you can just move this in progress. If you have other exams or assignment that you need to do, you can just do the same thing, and you can just keep dragging them, and you can put this one when it's completed, you put it there. And if there's another one that you're doing, you drag that and you put that there. And if this is a progress one too, you put it there. Okay. And if you need to copy this to create more, all you have to do is click on this arrow here, highlight that, Control C or Command C, and then you come down here and you Control V and you paste. And now you can change the color if you want. Highlight this, go to Table and go to Shading. And you can choose whatever color you want. So let's choose green. All right, so now you have that. All right, so that's how you can do all of this. Okay. All right, let's return this back. All right, so the next one will be group project. So if you have a group project, right, and you have the title, you're going to put it down here. You have the team member. You're going to list all your team members or your group partners, your project partners. You're going to list them here. The meeting notes, you're going to put down here the dates, the discussion points. You're going to make this a bullet list. I'm going to list them here. And task distribution. All right, so these are the tasks that you guys are doing. You're going to put the name of the person that task is assigned to. You're going to put the due dates that person needs to, talk to you guys about what they've done or present what they've done. And if it's completed, you're going to put complete here. If it's not, you're going to put in progress. If it hasn't started, you're going to say not started. Or if that person needs reminder, you're going to put that remind them. Okay, the next thing you can do if you use more than one person, if maybe you guys are 4, you can click on this and Control Enter and you can create more. Okay. All right, so if I keep going, it's going to push that research down. You see that? You're going to just keep creating. All right. We'll just leave 2 there for you guys. All right, so the next one is research. All right, so if you guys are doing research, you're going to put a research topic here and the objective of the research paper. You're going to put it there. Your references, you're going to put them there, including the website or any books. Going to put them there. And your notes, going to put a detailed note on your research right here. Right, we are making progress. And the next one is exam preparation. So click on that. So right here you have the weekly schedule. All right, and again this would take me to my Google Calendar. All right, so over here we have Monday, and that would be what subject am I focusing on. So this is kind of like a study preparation for your exam. So for Monday, what am I studying? I am studying maybe the heart, because I love the heart, right? So I'm studying the heart, and inside the heart we probably will studying the circulatory system, right? And that's what I'll be doing right here. And then over here, study time, I'll put the time I'm studying, maybe for 4 hours. I'll put it here. That would be a time block for me. And then here it will be my notes. Okay. And over here will be practice tests. So I'm going to put the course name here and the questions. So I'm going to write like practice question for myself, or I can go on the internet and look for practice questions. Then I can write my answers to the practice questions. And then I'll do my review and assessment and additional notes. I used to do, when I used to be in school, I used to study with this pattern. I have this study pattern that I call SQ3R. Some of you probably know about it. I don't know if people still use this method anymore, but that was what worked for me. For a lot of people, different things work for them, but for me, this was what worked for me, right? So SQ3R, this was the method I used for my studying. Okay, over here too. So this is Monday. Again, if you want Tuesday, Wednesday, Thursday, you can just Control Enter. Okay, and you just keep going. All right, And let me see if I added a page for this. Yes, I did. So over here too, you can either do it for Tuesday if you want, or Wednesday, but also you can make this like a week, like a weekly thing, whereby this whole week, Monday, Tuesday, Wednesday, Thursday, Friday, is this page that you studied for. But the way I built this, actually I built this for one particular day, okay, because all of this will be the day you study just this subject. Okay, so let me scratch that out. So this is just for one day, so Monday. So Tuesday will be here. So you come here and you clean this out and you put Tuesday. And when you go here again, you clean this out and that will be Wednesday. Okay, I remember now. That's how I that was my intention for this. Okay, so that's how you do it, and you just keep going. I'll leave this here for you guys. I won't delete it. I'll leave it here for you guys to use. All right, I didn't link these ones for you. It's because you guys can actually link it yourself to the month that you are in. Okay, so this one I link for the example. So if I click on this, it will take me to August, right? But we're no longer in August, we're in September. So whatever you want to do, you can link this by yourself. So how do you link this? You can go to your Google Calendar, all right, and you can go to the month that you are in, all right, say let's say September, and you can go to the URL area and just copy that link, and you can come here, highlight this icon, right click, go to link, and go to address. You paste that and you click OK, and that's it. You have this. And if you don't want this white to show, the white line, you can highlight this and go to this and click on that, and you're hiding it. So now if I click on this, it will take me to September, right? So that's where we are. All right, so you can do this one for yourself. All right. Okay, so the next thing we're going to do, we're going to go to personal life and well-being. All right, as a student, you also need to have your self-care plan. Okay, one of the discouraging thing that I've seen with students is that they study so hard, they go to clinicals, they spend time on the books, but they don't have time to take care of themselves. They don't have time to take care of their mental health. They don't have time to actually decompress and just relax. Okay, they don't have time for that. So here I put self-care plan whereby you can have the physical health, no exercise, diet and all of that, and mental health, medication, relaxation, social life, hang out with your friends. Come on, man, don't study. You got to have time for social life as well, right? It will help. It will help you. It will help. And you have to have a goal. All right, short-term goals, you have to have your steps to achieve them, long-term goals, steps to achieve them. All right, and over here you want to have your time management. Okay, weekly planner. Okay, Monday, Tuesday, Wednesday, Thursday, Friday, you're going to put them here, and your morning task, your afternoon task, your evening task, and your notes, so you can plan your day. If you plan to hang out with friends on a Friday, you want to make sure you have that plan there, so things don't come and take you away from that schedule. Okay, you want to make sure that time is for you to go socialize, is for you to go hang out with your friends, not be tempted to go open the books and start studying. You've done enough that week, right? So you want to relax, especially if you've done a lot of rotations, like you're in your rotations semester, where you just go to clinicals all week. All right, so I want to come back home, relax, decompress, and just either watch a movie or go to the movies or go hang out with your friends or go play some sport or something. And here I have where you can do your budgeting. All right, and I know I was once a student too. When sometimes you see that 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 check come in, you think you can blow everything out, right? No, you want to be careful. You want to be mindful. You want to also budget, right? Because you're a student, you got to try to make sure you stretch that money that is coming in. Okay, you don't want to blow everything out. So you want to put those things out here. All right. And if you need to create new ones, you go here and you just click on it and you have another one there. All right. I think that's it for this one. All right, so the next one is the career planning. So this one is something I just added because most students don't really know that when they are in school, that's when they're supposed to be doing their resume. Not when they graduate. It's when you're in school, you're supposed to be creating your resume. All right, so right here, and also I put something that is very important that people don't do. You want to have contacts of your preceptors, of the people you met, the doctors, the other nurses that are around there who are not your preceptors, the ones that you've worked with and they actually liked working with you and they've given you one or two advices or something, or they've actually helped you to do something, encourage you or lift you up somehow. You want to have their contact, at least if they give them to you, have their number, have their name, the position they have. There is a pharmacist or a doctor or a nurse, and their contact information like their phone or email address, and notes so you can remember who they are. Okay. And here you want to prepare your resume. All right, so I just put some highlights here. So personal information, that's what you want to put first, and the objectives of your resume, like your objective, why you're writing this resume, what's up, why you're writing it. Okay, your education, what you've done, what school you've went to, and then your clinical experiences, the clinical rotations you've done, and the months to maybe 3 weeks in a site, then another 3 weeks in another site. You want to put all your clinical experiences here and what you've done, the units you've been to. Was it the OR or the NI or the NICU or the CQ or the SICU, or whatever unit you've been to? You want to also list them there and what you've done, your skills. You want to put the skills that you've acquired when you were in this unit, in this hospital. Okay, you want to put them there. I want to have your portfolio layout. So your portfolio layout, you want to have your achievements. Okay, don't be scared to put the things you've achieved. Your clinical rotation 1, you want to put the details over here. And if there is another clinical rotation, so you're going to put 2. So you're going to come down here. After this, say right here, you're going to come down here and you're going to type another one, right? So you want to just put the things that you have done. All right, these are the things you've done. Don't let anybody take them away from you. That's your achievement. So put them down here. Don't be shy about what you've achieved. Your project that you've done with your classmates or project you've done by yourself, you can put them here. Okay, so that your prospective employer will see the type of person they're about to hire. Okay, that you are high achiever, right? All right, so something like that. And there you're going to put the job applications. All right, the job title, of course, is going to be nursing. The company, the hospital name, you're going to put it here. The dates you applied, you're going to put them here. All right, and then the clinical or the interview dates, don't forget your interview dates, put them here. And then the status, are you waiting to hear back from them, or are they calling your references or whatever it is? So you're going to put them there. And the notes, whatever notes you want to put there, you're going to put here. We're almost done, guys. All right, so the next and last one is your resources and references. All right, so nursing guides. Right here, it's the guide. All right, here you're going to put say guide title. You're going to put them here, whatever thing you guys do with your nursing, continued education. I am not a nurse, I'm a perfusionist, so I don't really do I don't really know what you guys do with your guides here. All right, so over here is going to be like nursing guide, like your maybe AORN standard thing. You're going to put things here, okay? Link sources, you can change all of this to whatever fits your needs, okay? And here you're going to put your summary, okay? And over here is your continued education, courses and certification title here, the provider, maybe it's a conference you attended, or maybe something you guys do in your institution, in your hospital. You're going to like a continuous education thing that gives you CEUs. You're going to put them here, and the dates you completed them, you're going to put here, and the notes that you want to put, you can put here. That board preparation. So this will be your NCLEX exam or whatever it is that you guys are preparing for. So it's going to be exam prep, going to be NCLEX, okay? And here you're going to be practice questions, all right? And review sessions, you know, schedule or notes. And then these are other licenses that you need to get. Repeat for other licenses as needed. So whatever licenses you're getting, you can just keep adding them here. All right, so I believe I've covered everything. I try to be quick. I hope you guys were able to get what I'm trying to explain about the nursing notebook. And granted, like I said, I'm not a nurse, or neither am I a nursing student, but I was able to create this using what I know as a healthcare professional. And if there is something that you guys needed to see or added here that I didn't add, you guys can email me, or you can leave a message in the description, in the comment section, and I can add them, or you can add them yourself, okay, if you want. All right, I am going to just say this whole thing is actually editable from A to Z. You can edit any of this the way you want. All right, you can edit them the way you want. All right, guys, that's what I have for you guys today. If you have any questions, please let me know in the comment section. If you have any comments, put them in the comment section as well. Please give this video a like, and if you haven't subscribed, please go ahead and subscribe. Thank you so much once again for coming and stopping by. And my next video will be on the perfusion student. So I'm a perfusionist, so I'll be able to cover more on the perfusion notebook for perfusion student. And I'll see you guys in the next video. Thank you and God bless. Bye bye.